I think it was here earlier on with a goodwill message from the deputy, for the goodwill message for UNEP, and is here also to give us this particular presentation for the next 15 minutes or thereabout.
I stand on the already existing protocols that have already been established. Distinguished colleagues, ladies and gentlemen, learning expands souls. This African proverb underscores the essence of why we are today, and we've heard from speaker after speaker, and we are learning in the course of listening to speaker after speaker, but we are here to learn and expand our knowledge on solutions to better expand and tackle these biosecurity threats in the continent. To most people, learning is very, very crucial, but learning environments are the source of many anxious moments. Specifically during our school days, the few minutes that preceded the announcement of our results saw many panicking, because either they have not scored good marks or they have scored just average. As practitioners and stakeholders of the biosecurity field, each and every one of us here today brings something to the table. We have been under testing for quite a very long time, and the past 2 years have tested us. The World Health Organization scores Africa's biosafety and biosecurity capacities at an average of only 32%. This is a failing grade if we were to score ourselves out of 100%. Failing grade, therefore, means that it's an alarm, considering the fact that biosecurity threats in the continent are only escalating. As I did allude in the morning today, the United Nations Environment Program Emissions Gap report that was released just 5 days ago showed that we are heading towards an apocalypse. We're going to see droughts and floods, which are already imminent today, plunging millions of people into suffering, because just a fraction of a degree means suffering for our brothers and sisters in communities. It means pain. It means death of our brothers and sisters. And as a result of this, we are going to see zoonotic diseases increase by up to 63%. This has happened in the last decade. And Africa holds an enviable position of having the highest incidences of antimicrobial resistance. And as we're speaking today, under the status quo in which we are in, 4.1 million people across sub-Saharan Africa will die as a result of antimicrobial resistance. That's what the data is telling us in the next 27 years. And studies have shown that antimicrobial resistance is accelerated by higher temperatures. And we have foodborne diseases as well. And Africa holds the world's highest per capita incidence of these diseases. And as we're speaking today, pathogens that cause foodborne infections are sensitive to temperature, because warm, wet weather conditions stimulate bacterial growth, that we know. But with Africa already warming twice as fast as the rest of the world, only shows that this risk will escalate. But hidden behind this, statistics are real-life stories. This is not theater, and this is not just abstraction. It is about real-life stories across the entire continent enduring this biosafety risk. We are seeing stories of children who are contracting malaria. This is not news to each and every one of us. We are seeing young brothers and sisters of ours hospitalized in intensive care unit. And we're seeing stories of families who have contracted anthrax, and the rest is only increasing. Cumulatively, what we know is that considering that biosecurity threats cost Africa over 400 billion US dollars in damages every year, the urgency for solutions therefore cannot be overstated. Because less than 2 years, we already heard about this. COVID hit our doorsteps, and we saw the reaction to this. But what we understand, as you heard earlier on today, is that we need to look at response measures differently. And that is why the building blocks of One Health becomes very, very important. And this should underpin our biosecurity solutions as we handle this. But our entry point from this perspective, from the UN Environment Program, which is part of a quadripartite with the World Health Organization, Food and Agricultural Organization, and the World Animal Organization, is addressing One Health, but from the UN Environment perspective, One Health is inextricably linked to the three planetary crises of climate change, of biodiversity loss, of pollution and waste. And as I said, our engagement in One Health is premised on two fundamental aspects. The first is that we have the environment, which is actually acting on one front as a reservoir for these infections and infectious diseases. On the environment acts as a solution, and therefore we cannot be able to address these biosecurity threats without putting environment at the center. Because let's face it, the reality that we face, distinguished colleagues, ladies and gentlemen, is that solutions in addressing this triple planetary crisis of climate change, biodiversity loss, and pollution needs to be leveraged and put at the center of addressing these biosecurity threats. Accordingly, we are working with state and non-state actors, because state alone cannot address the issues and non-state actors alone cannot address the issues. We need the collective force of each and everyone. But more critically, what do we need to do to address these realities through the environment lens in a holistic way? Each and every country, with Nigeria included, have put ambitious climate action plans, what we call the nationally determined contributions. It is estimated that global emissions need to be reduced by 45% between now and 2030. That's just in 8 years from today. If not, we are going to go above 1.5 degrees. And as I've said, over 83% of Africa's nationally determined contributions include greenhouse gas reduction targets to ensure that we can be able to reduce emissions. But what we need to understand is that Africa is a negligible emitter, emitting just between 3 to 4%, but it is bearing the brunt of this. But at the same time, these climate action plans that have been put by countries have not been turned into investment plans. 72% of Africa's NDCs have not been turned into investment plans. What does this mean? Attracting investment to implement and build climate resilience is still far-fetched, because some of these plans are still conditional, not unconditional. Countries therefore need to urgently develop such investments as part of the strategy in One Health towards making sure that we reduce the risk of infections, and at the same time also address